Get immediate positional pain relief. Pain relief from back pain, neck pain, shoulder pain, muscle pain, and get the best night's sleep. Adjustable beds have been around for many, many years now, but actually few people really know how to use them properly. So I'm going to show you 3 main positions that work wonderfully for adjustable beds and for you, as well as one additional feature. Chris, for the benefit of full disclosure, I've known you now for many years.
Yes.
However, this is the first time you've really lain on an adjustable bed. Would that be right?
That's correct.
Okay. So, just as a bed to lie on a comfortability rating, what would you give me out of 10 for this bed?
9.5.
Chris, I'm going to show you the very first position that we have, and I call this a lifestyle position. With this position, it's a super comfortable position for you to be able to watch TV perhaps, to read a book, to make some phone calls, to use your laptop or your iPad. Is that comfortable for you, Chris?
Yes, very comfortable.
It's better than having all these pillows shoved up behind you and you're trying to get yourself comfortable and everything else.
Yeah.
The secondary position that there is a pain management position. And I talk to people about this many, many times because they really need to understand it. You can take this bed, so basically you take the full back up and the legs up, so you're cocooned in this position. And this takes all the relief from your back. Now, I've never asked you, but do you ever suffer from back pain?
Yep, definitely.
Okay, lower back pain?
Yes.
Can you feel in this position, Chris, that it's actually took that pressure away from your back?
It has.
It does. So, in this position, what I'm saying is that you've got relief on the back, on the spine, and that will give you instant positional pain relief. This is not a sleeping position. This is a position to get therapy. So what you're wanting to do in this position is to just relax, spend 20 or 30 minutes, read a book or watch TV, as I've said, and at that point in time, put the massage on. Now we'll talk more about massage a little later. However, being in this position will, as I've said, start to relieve that pain. Now, I'm then going to lower you down. This is the third position that you would be at. In this position, what I'm aiming to do is to get Chris's nose at the same level as her toes. Nose to toes. Anywhere around here is the best sleeping position that you can have. Now, what we have here is gravity assisting with the circulation, Chris. So if ever you've got any, although you've got beautiful ankles there, but some people will suffer from fluid retention. And what this is doing is helping to put that through. Again, at this position, just before you go off to sleep, put the massage therapy on. Now, there's several things here. Many people tell me it's impossible to sleep on your back. It's very, very difficult. And it is. However, in an adjustable bed, it's actually very, very easy. Most people have fell asleep in a recliner chair. That's exactly what the same is. So, when you sleep on your side, and it's quite a problem when you sleep on your side, most of your arteries and veins are coming down the front and the outside of your body. As soon as you sleep on your side, you're trapping those arteries and veins, which means blood flow is not getting there. It's a bit like me creeping up behind somebody and putting my foot on a hose pipe as they're watering their garden. How much nourishment is the garden going to get? Not a lot. So Chris, I'm going to remind you what you've got to look forward to this evening. Okay, I'm going to lower your legs. And now I'm going to lower the back for you. Okay, I'm going to ask you a very important question now. Okay, where were you more comfortable, in the raised position or in the position you're in now?
The raised position.
In the raised position, definitely.
Definitely.
Okay, and I asked you before to rate this bed out of 10, and you gave me a wonderful 9.5. Okay, how would you rate the bed now in comparison to when you were raised?
4.
4? Okay, that's great. What we've done is we've reduced the bed from a 9.5 to a 4, even though it's the same bed. So you can see very easily what an adjustable bed can do for you. Within 5 minutes, I can have this lady give an honest answer from a 9.5 down to 4. You can see the benefits of what an adjustable bed can do for you. After all, every single hospital in the westernized world now has every single bed is adjustable in the same way. Now, they wouldn't have spent millions and millions and billions of dollars on changing every hospital bed from a flat bed to an adjustable bed if they didn't know that it's the best way to assist with recovery from operations or illnesses, and also to make sure we get a good night's sleep, because a good night's sleep is one of the best ways on the way to recovery for almost every ailment, both physical and mental, that you can have. So I said at the beginning that there's one additional feature. It's a feature overlooked by many people, but it's one that you should know of. As we get older, we find it more and more difficult to get out of bed on our own. This means that you're starting to lose your independence, and that's of great value as you're getting older. What you're able to in this situation is lift the bed all the way up, and then Chris, just swing your legs off the side and you can get out of bed extremely easy. No pressure on the back, no pressure on the heart, no pressure on a lot of the other limbs. How easy is that to get out? And you can leave it there to get back into bed the same way. If that assists with maintaining your independence and stop having to have somebody there to help you get in and out of bed, and keeps you away 1 more year from the nursing home, then it's paid for itself already. You can request more information here or call us on 1300 271 279. I promise you 2 things. First of all, we don't bite, and secondly, we don't pressure you into making a decision. We believe that we can offer the best information and guidance on an adjustable bed to assist with you making the correct purchasing decision.